Virginia is now asking hospitals and healthcare providers to immediately report when a child is hospitalized from exposure to THC or CBD. New at 5, 10 on your side, Stephanie Hudson is looking into the reason and spoke with an emergency room doctor at CHKD about what they're seeing. Stephanie.
Tom, the State Department of Health wants to get a better idea of the adverse effects of THC and CBD on kids. While doctors tell me that most who go to the emergency departments will be treated and recover, a 4-year-old from Spotsylvania County, Virginia died after consuming a large amount of gummies in 2022. A local emergency room doctor told me today about the kinds of cases CHKD has seen growing over the past several years.
It often looks like candy, chips, or cookies, and when a toddler finds one, they just can't help themselves.
And most parents, when they bring their children in, don't have any idea that they have ingested cannabis. They don't know.
The emergency department at CHKD sees a couple of kids a month.
Some of the more severe kids will have problems with breathing, problems with their blood pressure, problems with seizures.
Dr. Faika Qureshi has seen more than a few hospitalized with a tube down the child's mouth or nose to help them breathe.
People don't realize that if they're smoking marijuana and they're inhaling it around a child and then the air is filled with it, children can inhale and get symptoms from there.
The Virginia Hospital and Healthcare Association gathered numbers from across the Commonwealth and found 2,551 children went to emergency departments in Virginia last year because they ate, inhaled, or were otherwise exposed to THC or CBD. While the numbers of ED visits dipped slightly in the second half of the year, concern about the general trend prompted the Department of Health to establish a new surveillance system to get a better grasp of what's going on with kids and cannabis, information that could help determine future legislation or other response.
Funding, education, so that parents realize, because it's just that a lot of parents have no clue that this could happen to their child.
CHKD is developing a workflow to facilitate reporting to the state. Dr. Qureshi tells me that while most children exposed will recover in a couple of hours or days, parents who have these products should treat them like they would a gun and lock them up. Stephanie Hudson, 10 on your side.